Veterans from different eras do have different sets of needs, and especially with our Vietnam era veterans, part of that is the willingness and the openness to come in and embrace the VA and see what it has to offer, or the vet center, and are sometimes surprised, as Dave says, about the reaction. To complicate that, now they're getting older, right? Many of them are retired. That means more time sitting at home thinking about stuff. And needing to find other ways to occupy themselves, because sitting at home thinking about stuff is not very pleasant to somebody who's got a trauma they've been suppressing for years.
50 years. For
50 years.
Yeah, many years. What are some of the discussions you have with veterans and their needs emotionally and mentally, and that isolation that they may be feeling?
Well, there's a lot that we talk about, and it really varies depending on who the veteran is. Mm-hmm. Sometimes they want to talk about what's going on with their family. Many times what they don't want to talk about is the trauma, is the issue related to PTSD, if that's what they're experiencing. A classic sign of PTSD is avoidance, is not wanting to go there, not wanting to think about triggers, reminders, or the experience itself. And yet it turns out that it's very therapeutic to do that in a constructive way. It's a core element of treatment for PTSD, is finding a healthy way to go through and experience that trauma in a way that is corrective, in a way that helps process it a new way, so there's a new understanding and a new resolution.
Is that a constant process?
It's not constant, but it's ongoing. So recently my daughter was in a car accident here in Spokane. She broke her wrist. After a couple of casts, she got it out and needed to do some physical therapy. And so what happened is the physical therapist sat down and said, okay, this is going to hurt, it's going to be painful, you're not going to like it. But it's really important to do this if you're going to get your mobility back and the functioning in your wrist. Therapy for PTSD is a lot like that. It's painful, it hurts, it's not comfortable, but it works, and it helps restore some of it helps provide some relief, it helps restore some of the functioning, some of the mobility that our veterans have.
Mm-hmm. Group therapy helps?
Group therapy helps as well. They're very effective therapies, both individual and group therapies. There are some real advantages to group therapies, because veterans also have other veterans with whom to connect and bond and share experiences and learn from.